post-traumatic stress disorder, (PTSD). PTSD is a severe psychological disturbance following a traumatic event characterized by involuntary re-experiencing of elements of the event, with symptoms of hyperarousal, avoidance, emotional numbing. Onset is usually within 6 months of stressor, although it may rarely exceed this, and symptoms persist for at least 1 month. Risk of developing PTSD after a traumatic event is 8 to 13% for men, 20 to 30% for women. Lifetime prevalence estimated as 7.8%, MF equals 1 to 2. Cultural differences exist. Some types of stressors are associated with higher rates of PTSD, for example rape, torture, being a prisoner of war. Although PTSD can appear at any age, it is most prevalent in young adults, because they tend to be more exposed to precipitating situations. PTSD is most likely to occur in those who are single, divorced, widowed, socially withdrawn, or of low socioeconomic level, but anyone can be affected also. Causes of PTSD. 1. Psychological, fear response to harmless situations associated with original trauma, perhaps due to emotional memories. 2. Biological, neurophysiological changes leading to permanent neuronal changes as a result of the effects of chronic stress or persistent re-experiencing of the stressful event. Neurotransmitters implicated, catecholamines, 5-HT, GABA, opioids, and glucocorticoids. 3. Neuroimaging, reduced hippocampal volume. Dysfunction of the amygdala, hippocampus, septum, and prefrontal cortex may lead to enhanced fear response. 4. Genetic, higher concordance rates seen in monozygotic than dizygotic twins. Risk factors of PTSD. Low education, lower social class, female gender, low self-esteem, previous, or family, history of psychiatric problems, especially mood/anxiety disorders. Previous traumatic events, including adverse childhood experiences and abuse. Peritraumatic factors, trauma severity, perceived life threat, peritraumatic emotions, peritraumatic dissociation. Protective factors for PTSD. High IQ, higher social class, Caucasian, male gender, psychopathic traits, chance to view body of dead person. Signs and symptoms of PTSD. 1. Directly experiencing the traumatic event. 2. Witnessing, in person, the events as it occurred to others. 3. Learning that the traumatic events occurred to a close family member or close friend. 4. Experiencing repeated or extreme exposure to aversive details of the traumatic events. 5. Recurrent, involuntary, and intrusive distressing memories of the traumatic events. 6. Recurrent distressing dreams in which the content and/or affect of the dream are related to the traumatic events. 7. Dissociative reactions, for example, flashbacks, in which the individual feels or acts as if the traumatic events were occurring. 8. Avoidance of or efforts to avoid distressing memories, thoughts, or feelings about or closely associated with the traumatic event. 9. Avoidance of external reminders that arouse distressing memories, thoughts, or feelings about or closely associated with the traumatic event. 10. Irritable behavior and angry outbursts, with little or no provocation, typically expressed as verbal or physical aggression toward people or objects. 11. Reckless or self-destructive behavior, hypervigilance, exaggerated startle response, problems with concentration, sleep disturbance. Symptomatic treatment. Sleep disturbance, you are given mirtazapine, zolpidem. Anxiety, you are given clonazepam, propranolol. Psychotic symptoms/severe aggression or agitation, may warrant use of antipsychotic, olanzapine, risperidone, quetiapine, clorazepine, aripiprazole. Psychological, CBT and EMDR. CBT includes elements of education about the nature of PTSD, self-monitoring of symptoms, anxiety management, breathing techniques. Eye movement desensitization and reprocessing, EMDR, is treatment using voluntary multisaccadic eye movements to reduce anxiety associated with disturbing thoughts. EMDR helps process emotions associated with traumatic experiences. Prognosis of PTSD. Approximately 50% will recover within first year while 30% will run a chronic course. Outcome depends on initial symptom severity. Recovery will be helped by good social support, lack of negative responses from others, absence of maladaptive coping mechanisms, for example avoidance, denial,